Hi guys, it's Shay. So today what I wanted to do was to continue where I'm at right now in my cancer journey. So the first video that I made was saying that I was diagnosed with Hodgkin's lymphoma. So the type of Hodgkin's that I have is nodular sclerosis, classical Hodgkin's lymphoma. My staging is 2A, which means that my cancer, it's all in my chest, but it's not above it and it's not below it. And the A means that I don't have symptoms B, which symptoms B are fever, weight loss, and drenching night sweats. So I am considered 2A, non-bulky, which means that the mass isn't big enough to require radiation. So I won't have to do radiation unless I want to do it as a treatment option. So right now, that's where I'm at with the staging and the type of cancer that I have. The treatment options that my doctor provided, she gave me 3 options. So if your doctor gives you options and you have cancer and you want more options, always feel free to ask, are there more options? If you're interested in the research that's going on right now with the type of cancer you have, ask if there's a clinical trial that you can get on if that's something that you're interested in doing. So the 3 options that she gave me were 2 cycles of chemo, negative PET scan, 2 more cycles of chemo, followed by radiation. And this lasted, I think, around 4 months. My second option was 2 cycles of chemo, negative PET scan, followed by 4 cycles of chemo. The last option, and that second option was around 6 months. The last option is going to be around 10 months, and it is a clinical trial because immunotherapy drugs are not a primary treatment option right now. They're still in the trial phases. So it is a clinical trial. And it was 3 cycles of chemo, followed by a negative PET scan, and then 8 cycles of immunotherapy drugs. So for me, I didn't want to do radiation at all. And that is because most of my cancer is on the left side of my chest, which means that it's right there by my heart, my lungs are there, and there's breast tissue, which means that later down the road, if the radiation got in that tissue, it can start cancer there, and I don't want to do this again. I don't want to ever do this again. So radiation was out for me. Chemotherapy drugs, they hurt your healthy cells. They're toxins. They can kill you. They can cause a secondary cancer. I wanted to do the least amount possible with the chemo, so that left me at the clinical trial. So the clinical trial was the least amount of chemo, but it was the longest treatment period, but it was followed by immunotherapy. So that's what I chose. I had done research prior on immunotherapy drugs, and I still stick by my decision, and I still honestly feel like I made the best decision, even though it's going to be 10 months versus 4 and 6 months. I don't want to pump my body full of chemicals, and I don't want to do radiation, and I honestly feel blessed that I even have this opportunity to get on this clinical trial, and I don't even think there were a lot of spots left. I think it's 83 people total in this study. 30 are going to come from MD. And I think there may be like 1 or 2 more spots left after I had decided to do it. So I'm really blessed that that was there for me to do as a treatment option. And I know like clinical trials probably scares a lot of people, but it doesn't scare me. I have a Bachelor of Science degree, and I know that in order to get to this point of doing clinical trials on people, your numbers have to be there, your research has to be there, and it's not just something that happens overnight and they go, oh hey, we're just going to test on people. Like, it's not how it works at all. My doctor even thought that this could be a better treatment option than just doing chemo, which has been very effective and shown great results. She believed in the immunotherapy drugs, and I did too as I was researching this, and it's a lot less harmful on your body. So that's what I decided to do. So what my immunotherapy drug is going to do is it's basically going to block this protein called PD-1, and what this protein does is it prevents my T cells from recognizing and attacking cancer. So it's going to go ahead and block that. What it's also going to do is it's going to activate and enhance my T cells to attack cancer cells. So basically all this drug is going to do is it is going to block the stuff that's preventing my body from recognizing cancer, and it's going to enhance and boost up my cells to attack the cancer. So I think that's really neat, and that's really cool. As someone who like really loves science, I just think that's really cool and neat, and I'm really excited to be a part of it. The more I research, the happier I get, I guess, in a way, for someone who has cancer. It makes me happy to be a part of this, and I feel like I'm going to help future generations to see if this can be a primary treatment option instead of doing chemo. I hope that it honestly gets to that point where it's just a treatment option and that you don't have to pump your body full of toxins. This is a lot better treatment option, I think, and I think the numbers and the results are really showing that it's definitely holding its own compared to chemo. Like it's doing the job just as chemo would do without having all those crazy side effects. So that's where I'm at. As far as my YouTube channel, what I think I'm going to do is, since this is a clinical trial and since this is not a regular treatment option, I think I'm going to vlog the entire experience, because I'm going to have to do chemo and then I'm going to be doing the immunotherapy drugs later. So I'm going to vlog it and compare what it's like, I guess, at the end. And as I'm going through, just kind of tell you guys what the chemo's like, and then tell you guys what the immunotherapy's like. And I also think I want to do some videos on just talking about immunotherapies. I do a lot of research all the time on like Google Scholar, where I just read studies and read the numbers and read the results, and that's all I've been doing, and I'm happy with the results that is showing for the drug that I'll be taking for my immunotherapy. So that's where I'm at. Always feel free to reach out to me if you have any questions or anything like that. If you want to follow this journey and see what the chemo and the immunotherapy is going to be like, feel free to subscribe if you would like to. But yeah, that's where I'm at.